Thank you for joining us again on our Dentox 1 minute tip of the day. Today we're going to talk about gummy smiles. Now, when we treat a gummy smile, the goal of the treatment is to relax a hypertonic lip. In other words, there's muscles that run down the side of the nose and under the nose that lift up the lip so that when the patient smiles, they show more gum than tooth. And that's the most important tip. The patient has to show at least as much gum as tooth because it's unpredictable how far the lip is going to come down when you relax the lip. So let's say, for example, somebody has a front tooth and that front tooth is 10 or 11 millimeters long. The amount of gum that's showing also has to be 10 to 11 meters long because if you relax the lip, you don't know if the lip is going to drop too far down. So in other words, if they have a slight gummy smile, let's say 4 or 5 millimeters of gum showing, but they have a 10 millimeter tooth, the lip will drape below the biting edge, below the incisal edges of the teeth, and the patient's going to look like this when you finish treating a gummy smile. So remember that the amount of lip that shows, let me say that again, the amount of gum that shows should match the length of the tooth. Otherwise, my advice to you is don't touch that case. Thank you for joining us again on our Dentox 1 minute tip of the day.